points that you need to bear in mind. The scientific officer for this topic is actually Maria Teresa de Magistris, but she's not able to be with us today, so I'm just giving this presentation on her behalf. So what is the goal of the webinar? Well, it's to really give you the chance to get an in-depth look at the core topic, its objectives, why we need it, the structure, a very important point, what we expect from you, the applicants, and what the EFPIA members will contribute, and what the key deliverables will be. We're not going to go into detail on the rules and procedures of IMI. There was a webinar on this recently, and the presentation and the recording are available online. If you have some basic questions, though, we can probably answer those today, so don't worry. So some tips for you when you are submitting a proposal. The first one, and this is probably the most important one, is to read all the relevant material on the website on this topic. You've obviously got the core text, but there are also rules for submission, the evaluation guide as well. It's all there. I really advise you to read it so that you can be sure you understand what it is you need to do. Again, understand the IMI2 rules and respect them. If you have any questions at any point, then contact us. It's really our job to help you. I would ask you, however, not to contact the EFPIA topic coordinator because that could raise issues of conflict of interest and things. So please send any questions you have to us. Again, it seems obvious, but the reviewers will need to evaluate your proposal, and they can only evaluate what you send them. So make sure you give them all the information they need. Start working early. I guess most of you have started working already. I would hope you have. But if not, then really start working now. And for future calls for proposals as well, keep an eye on the IMI website because we do publish draft text before the actual call launch. And finally, this seems a very obvious one, but don't forget to finalize and submit your proposal in the system. So some common mistakes that we see, which you should obviously avoid. One is a missed deadline. The deadline is, if I remember correctly, 5 o'clock in the afternoon, Brussels time on the 12th of January. Again, it's an online submission system, so don't wait until 5 seconds before the deadline to press submit, because by the time your application travels down the internet wires to us, it might be after the deadline. So give yourself plenty of time. Give yourself plenty of time to fill in the information in Sophia as well. Another thing we see is the proposal is out of scope. Again, the topic text and the presentation you'll see today will make it very clear what we need from you, so make sure you stick to that. Again, make sure you respect the proposal template, and don't forget the very basic minimum number of requirements you need. We do have to, we only provide funding to consortia, so an application from a single researcher is not going to get through. Things to watch out for, obviously redundancy between partners. On the one hand, you do need to make sure that you have partners who can address all of the issues, all of the aspects of the topic text, but equally there shouldn't be too much duplication. At the same time, make sure you don't ignore some objectives. And finally, there's sometimes we see an issue of limited impact of the proposal, so it's not enough to be scientifically excellent. So how to find a project partner. The most important way is to actually network with your existing contacts to find people who are applying. You can also network with your webinar and run that list later. We do provide that should be helpful to you. You can use your national on social media, and also so on that note, there are contact details through.
children, it also has a significant burden in the elderly. The infection can lead to episodes of bronchiolitis and pneumonia, and it's estimated that, in fact, there are 3.4 million hospitalizations globally each season from RSV. Early infection, early in life, may increase the susceptibility to allergic asthma, and that is one of the questions that we hope to explore. And as well, and I think this is intuitive from the consequences of RSV, there's a high economic burden associated with it. Next slide, please. So there are, in fact, a lot of challenges today in understanding and documenting RSV. It's poorly understood in terms of the public health needs surrounding it, and there's also not a clear understanding of the burden of disease and the costs associated with it, especially in the elderly. I think there's a lack of well-articulated incentives to conduct research into the prevention of RSV, and that's what we're hoping to do with this project, is resolve that challenge. And as well, there's a lack of clear predictability or classification of disease severity, as well as its long-term consequences. So we're hoping with this project that we will address these challenges, and this will in fact lead to better care for patients, and as a result, reduce costs, and also aid in the development of potential treatments as well as vaccines. Next, to do that is by producing a robust data set that will increase our overall understanding of RSV disease and its clinical, economic, and social impact. And hopefully, as I said earlier, this will lead to better treatment as well as better preventive options for preventing RSV. Next slide, please. So we feel that it's important to create a neutral platform for this body of knowledge. IMI is the best resource. We hope that this will be a very highly collaborative approach on the awareness amongst industry and policymakers, so that eventually it will lead to of this basically much ignored and not acknowledged disease. The IMI approach, we feel, will ensure that different perspectives and a wide range of different evidence sources will be consolidated under one platform, so that it will lead to synergies across this platform and a broader understanding of different aspects of the disease. The incentives are very limited, and because there isn't a real incentive to accurately record on highly underdiagnosed and under-recognized today. And we feel that part of this is driven by a lack of funding for the prevention and treatment of RSV, and as well as developing classification for understanding and an ability to predict the long-term sequelae of the disease. So we're hoping that by having this public-private collaboration, we'll be able to address these challenges. Next slide, please. So the overall objectives for the full project is to develop a detailed understanding of the clinical, economic, and social impacts of RSV across all age populations, so infants to elderly, as well as focusing on some high-risk populations. The collated data will drive new approaches to the prevention and treatment of RSV and its consequences, and will hopefully give us a better understanding of the resource requirements and costs associated with RSV, so we'll have a deeper understanding of the burden of disease overall. We're also hoping to explore the feasibility of developing biomarkers and establishing biobanks, which are repositories of biological materials for RSV infections, and linking existing sources of material that are in place today. We'd also like to investigate the long-term implications of RSV infection, including wheezing and asthma, which are recognized potential complications, and gain a better understanding of how these relate to the disease. Next slide, please. So we feel that we are in a pre-competitive space. This project does not focus on one solution. What it attempts to do more clearly describe the problem and describe the landscape around RSV. We're hoping to develop a robust data set that will give us greater insights into the disease and its impacts and costs, and hopefully lead eventually to better treatment and preventative options. However, that is not in scope for this project. Action is, however, required to address the needs that will be identified and to create policy changes to improve outcomes and reduce the impact, both financial and clinical, of RSV infection. We're hoping that this project should develop synergies and explore collaboration with existing consortia that are already in place in small pockets across Europe and link them together, and other relevant initiatives should be included in the proposals to avoid duplications and leverage and expand on existing work that's currently underway. So we're not expecting to duplicate or reinvent existing activities. So we have developed a framework or an architecture for this project by work package, which is basically the way that IMI expands and sort of describes their projects. So the first work package would be a literature review of RSV and the current perceptions on the burden of disease. So what knowledge is already in place and what can we do to understand where the gaps are with this knowledge. Work package 2 would be a consolidation of all the healthcare systems data that's already in place. Work package 3 would look at existing retrospective databases and look at linking them and analyzing them and drawing initial conclusions around RSV. Work package 4 would then develop a prospective data collection approach that would hopefully be more comprehensive, because we could proactively screen and test for RSV so that we get all patients within the catchment area. And then work package 5 would look at presumed risk factors and biomarkers for RSV-related severe disease and expand and develop on them. And then work package 6 would be the management office and the coordinating resource for all of the other work packages. So it would basically be an administrative structure for the project overall. Next slide, please. So what we're hoping from the consortia is the ability to assemble and coordinate multi-stakeholder discussions. We think that there's a lot of resources and sources of information on RSV, and it's a matter of creating an interface between these different organizations so that they can communicate clearly. We hope that the existing applicants will have, or the future applicants will have, experience with public health issues management and the ability to clearly communicate key public health messages so that the outputs of this project will be clearly communicated, whether it's in the literature or through more immediate forms of communication. We are hoping that they have experience with healthcare resource modeling and economic analysis so that they can understand and describe the burden of the disease and project it through models. We hope that they have experience in handling and analyzing complex and large data sets from multiple sources, and this expressly addresses the challenge of work package 3 when looking at retrospective databases. We're hoping that they have experience in tracking RSV disease in an inpatient as well as outpatient setting, and this should help with not only work package 3 but work package 4 as well. experience with biomarker discovery and assessment, including establishing links with disease, and an understanding of biobanking in the context of RSV disease. Next slide, please. So what we expect from the EFPIA side of the equation is experience in developing approaches to data and identifying epidemiologic and resource usage trends. We hope that the consortia will also be able to supply an analysis and aggregation of large data sets from diverse settings. We want members to have economic modeling and healthcare resource utilization experience. We want them to have an understanding in establishing surveillance, and as well to be able to assist in managing the project with their alliance management teams, meeting facilities and resource, and the communication expertise that industry has. Next slide, please. So what is in this for you, or I guess for the recipients of the project overall, based on which area you represent? So for public health, we're hoping that we will establish a priority and a richer understanding on the burden associated with RSV, including the epidemiology and the cost burden of the disease. And we hope that this sparks initiatives to classify and predict the disease outcome, as well as to prevent and treat RSV. For industry, we are hoping to establish at-risk populations with the evidence to support this. We hope to build a base to establish cost-effectiveness of alternative treatments so that we understand both the prevention and treatment options. And we hope to develop specific data to support R&D decisions into the future as we get into specific development programs. For academia, we're hoping to advance the body of knowledge surrounding RSV and to establish unique data sources that will serve for future investigation as a result of having had this project in place. And then for governments and payers, we're hoping that the development of an evidence database for the assessment of preventative approaches and treatment of RSV will help them to understand more clearly the cost and the burden associated with managing RSV. Next slide, please. So in terms of the overall deliverables for the project, what we hope to generate is an analysis of the direct and indirect costs associated with RSV infections overall. We'd like to create a consensus on the need for action to prevent and treat RSV. We hope to have improved linkage between public health perspectives on the management of RSV and incentives for R&D development and investment. And as well, we want to leverage existing cohorts and epidemiology networks, as well as establishing new ones. And we want to use them to explore biomarkers associated with the severity of disease and the long-term sequelae, protection from disease or reinfection, outpatient and inpatient comparisons, the contribution of co-infections in disease severity, as well as the composition of the microbiome related to disease severity. Next slide, please. So in terms of researching the key deliverables and what we expect to have from the project is we are hoping that by the end of the 5-year project, we'll have a robust body of evidence that's in the public domain that can be used to create templates and ask future resource questions into RSV. What we hope to have included in the project is a validated and consolidated review of the current literature and the evidence that's currently in the public domain. We hope to have a database of currently available surveillance data from existing registries and other health systems architecture that's in place. We hope to establish a framework for analyzing and aggregating the burden of RSV disease, including the short, medium, and long-term consequences and costs of the disease. We will hope to prospectively accrue data within a registry that captures the true incidence of RSV, as well as resultant events. This would include, but not limited to, GP attendance at disease, hospitalization and a description of those hospitalizations, as well as a description of the long-term sequelae of the disease, which would potentially include, but not be limited to, bronchiolitis, wheeze, and asthma. We hope that there is a clear publication plan as well as a data availability plan associated as one of the outcomes of this project. Next slide, please. So to date, we have established a consortia on the EFPIA side of 5 member companies, and we feel confident that these companies will be able to deliver on the EFPIA side of the equation. The expected duration of the project will be 5 years, and currently the indicative budget for this project is 14.5 million euros from each of EFPIA and the IMI2 contribution. So next slide, please. So I am now going to turn it back to Catherine for questions.
Okay, thank you very much, Judy. So you can see there again the InfoDesk email address that you can contact us on after today's webinar, but meanwhile, here is the information you need to send questions in now. I already have a small number here, but for the rest of you, don't be shy. Go ahead and ask your question either by typing it into the question panel and hitting send, or you can raise your hand and ask the question over the phone. I'm going to start with some questions from Andrew Pollard, which are actually a bit more on the rules and procedure side. So he asks, we have access to samples from outside of Europe and potential for some activities to be undertaken there. Number one, is it acceptable to address the questions on samples from outside of Europe, and are partners from outside of Europe allowed to receive any funding? So the first question on the use of samples from outside Europe, I don't know the answer to that one. What I will do is I will run this by some colleagues in the legal team, and we'll send the answer out to you when we send out the information with the link to the presentation. For the second one, I've just double-checked as well in the core text, and on page 53, there is the section list of countries and applicable rules for funding, and there it says that it's really only countries, organisations established in an EU member state or an associated country. So these are the countries that are associated to Horizon 2020 but aren't EU members, so people like Norway and Iceland and those kinds of places. So in principle, I'm afraid not at the moment, but again, I will double check that with my legal colleagues. The next question from Andrew is more one for you, Judith. So he asks, we believe that we can carefully characterize biomarkers in adults and elderly using the human challenge model of RSV, where we can carefully document time of infection and kinetics of responses to focus research in patient cohorts. Is the use of the challenge model acceptable to inform the biomarker questions in the call in WP5?
I think it's one of the strategies that you could employ, and I think that what you need to do is look at the total question and whether or not the human challenge would answer all of it, or whether you would have this as part of your answer and use other models for other age cohorts or other parts of the population.
Okay, thank you. Nicolas Espitalier has a question concerning the suggested architecture of the work packages. Is it possible to amend it, for instance, to create a new work package? I don't know if you have any thoughts on that, Judith.
I think the answer is it depends. If you feel that there is a substantial gap that isn't addressed by the current work packages, and that an additional work package would help to focus the research and describe additional worthwhile projects that are related to the overall project, I think that's acceptable. I think that if it's a total tangent and that particular piece of work isn't related to the overall project, it may not be viewed to be as acceptable by the reviewers.
Okay, thanks, Judith. So, again, just to reiterate that when you put in your proposal, you really need to make sure that your proposal addresses everything in the topic text. So if you do decide to rearrange the work packages, make sure you don't miss anything out as well. We have a question from Laura DeLisa. Do you think that a pharmaceutical company is not fit for this project? It looks like that such a company might be a stakeholder for the project ambition and continuation, doesn't it? I'm not sure I fully get the question, Judith. I don't know if you have any comments on that.
This particular project is in the pre-competitive space. I think that there's a need to address the gap in knowledge, and if in fact it's the pharma industry that is going to address that gap and they're going to collaborate in resolving it, I don't see that it's any conflict of interest. But I mean, everyone is allowed to have their personal opinions on this.
Exactly. But I mean, I would also add as well that, I mean, IMI by definition is a public-private partnership, so we're always going to have the pharmaceutical companies on board, and as Judith said, it's really the goal to work in these pre-competitive areas and solve challenges that are actually common to not just the pharmaceutical industry, but to other researchers, to public health bodies as well. So, I mean, the impact of this project and the people who benefit from it should be very broad. We have another question from Nicolas Espitalier. Still in the suggested architecture, what about the dissemination, transferability, and sustainability?
Well, I think that's a very important element of the project, and we're expecting to have a publication plan associated with the anticipated outputs, as well as looking at other forums where we can, in fact, contribute to the sort of public knowledge around the outputs around RSV. So over and above the scientific literature, often there's a website that's associated with the project where we can disseminate information, as well as developing linkages with different stakeholders that are interested in RSV so that they have a clear understanding of our project and the progress that we're making as we get to milestones in the project.
Okay. We have another question from Andrew Pollard. Will the EFPIA members provide only the in-kind contributions which were listed on the slides, or will there be offers of assays, for example, VNA, or financial contributions?
The expectation now is that there will be in-kind contributions as well as data contributions, and as well as assays. So it depends on how the project is structured, what is available from the EFPIA members, and the best way to contribute those contributions. So at this point, there's no expectation of cash specifically from the EFPIA members, but that could change as the final project is developed.
Okay. We have a question from Cyrus Park. How important is the distribution between pediatric and elderly RSV throughout the project? Is it advantageous to equally address one or the other?
Our hope is that we will address all, because as we said, this is a pre-competitive project in the sort of the pre-competitive space. So we're hoping that by equally addressing the infant as well as the elderly population, that it will provide knowledge to whoever wants to advance this work and continue on. So it's breadth that we're looking for.
Okay, and Peter Openshaw asks, if we find biomarkers in man, want to understand them better and explore mechanisms, are animal studies possible under this call? We weren't expecting to have studies specifically, but if you feel that that's valuable to the overall output of the study, it is up to you as a consortia on whether or not you feel that you could include it. And this goes back to the other question from the other participant who asked if we could add a work package. But we weren't expecting that necessarily at this time. Okay, thank you. That's it for the questions at the moment, so thank you very much to all of you for sending those in. If you have any other questions, then I suggest you get typing. Otherwise, I'll just remind you that all of the information on the call is on the IMI website. If anything isn't clear, or if you have questions, then do get back to us. As I said, I will get back to all of you on the question asked by Andrew at the start of the question and answer session. So I cannot see any further questions coming in, so I'm going to thank Judith for her presentation and for her time, and I'm going to wish you all the very best of luck with your applications, and thank you for attending. Bye-bye, everyone.
Okay, thank you very much, Catherine.